series. As you know, that EGROW Foundation for Economic Growth and Welfare, is a research-based policy body, and we believe in policy-oriented research. It is in this very context that we started this webinar series on contemporary burning issues, and we were very fortunate that we have had a very good mix of the best minds across the world, Indians and foreigners, speak to us on important issues. We have had privilege of hosting two Nobel laureates. We have had speakers from Columbia, from Harvard, from Stanford speak to us, as well as we have had policy makers speak to us from within our own country. So we have had a very good mix of speakers. It is in that very context that today's study is being discussed. The author of today's study brings in a very good perspective, Dr. Surjit Bhalla from the International Monetary Fund. To chair this session today, we have our chairman, Dr. Arvind Virmani, to chair the session today. And as we all know, Dr. Arvind Virmani has also himself been extensively involved in policy making. He was with the Planning Commission for a very long time. He was the chief economic advisor of our country and also the executive director at the International Monetary Fund. He has published extensively in refereed journals and he has books to his credit. He is himself an avid scholar and reputed scholar of our country. With this, I hand over the session to Dr. Arvind Virmani to conduct the proceedings.
Thank you. So let me, of course, all of you know Dr. Surjit Bhalla. He's spoken to us before also. He is currently the Executive Director, IMF. So Surjit, with that, let me hand it over to you. And then, of course, after you finish, we will have the discussant, Professor Kundu, and I'll introduce him then.
Yeah.
Dr. Bhalla.
Thank you very much. Let me get the sharing thing done. Thank you all, Arvind and Karan, for inviting me for this seminar. My co-author, Karan, and Arvind has also been a co-author of this paper, and Karan may be joining a bit later. And I'm very pleased that Amitabh is the discussant. I've known him for a very long time, and we were colleagues together, and therefore he can bring a perspective. We were colleagues on the first National Statistical Commission with Tendulkar. So this is all very relevant for poverty discussion on there. Okay, so look forward to it. Let me just go through, and this paper jointly with Arvind and Karan has been in discussion, and what I'll try and present here are some, along with the paper which has been distributed, some queries that arise from the estimate of poverty available in the world, and with special reference, obviously, to the World Bank, because that's the organization that really is the gold standard for poverty estimates and measurement. And so with that background, let me just proceed with to do. Okay, essentially poverty calculations involve several choices. And what we'll try and do here is to point out some divergences in the choices that people made. And I hope, Amitabh, this is especially for you, these questions, because you have studied this in quite big detail as well. And the calculations are as follows. First, the choice is whether you do an income survey or you do a consumption survey. And India traditionally, especially through the NSS, the official survey organization, has eschewed the conduct of income surveys. So this is on expenditure survey. Then, one way, and India has been, has been doing consumption surveys since the 50s and has been at the forefront in the world in terms of the definitions used, the measurement techniques used, and indeed, we are the gold standard for the rest of the world, especially for the rest of the developing world. And it is in this context that what we have in India gone through that traditionally we went ahead and measured consumption, all consumption, whether it was salt or whether it was a car, on the basis of how much did you consume over the last 30 days. Now, in 1983, reflecting the changes in the Indian economy, which were beginning to take place, and broadly, the poverty in India between 1950 and 1980 stayed broadly the same. So this 1983 development is a rather important recognition on the part of the NSS that, look, maybe we need to do a different measure of or method of recall. And they brought in a 365-day recall for major consumer items, for durables. And this is called the mixed recall. Then in 93, 94, the next, not the next, but the two years, two NSS of surveys after the 1983, that 5 major categories of consumption: clothing, footwear, durables, education, expenditures, and health. These questions were then asked of all respondents, their expenditures on these items on a 365-day basis. And obviously, it was then adjusted to 30 days to make everything comparable. But the key here is clothing or footwear or cars or education. How much did you spend on education? Was previously asked, how much did you spend in the previous 30 days? Now it was on the previous 365 days. Now, not, as I mentioned, that India has been very prominent in the poverty measurement discussion, poverty levels discussion, and other officials around the world, including Angus Deaton, other experts rather around the world, including Angus Deaton, have been working on these issues along with the World Bank and the Living Standards Measurement Study. And one of the conclusions of the Living Standards Measurement Study was that the recall period is a rather important parameter in the estimation of poverty. And they then recommended, as well as the NSSO, that lower recall periods serve to measure actual consumption better. And so the 7-day recall was introduced in 99-2000 survey, and this was for perishables, fruits and vegetables. So now you have that basically, as per the recommendations of all the experts, including the World Bank, and I want to emphasize, including the World Bank, that look, recall period matters, and therefore we have to move with the times, with the experts' opinions, with what the results are, and that the recall period of 7-day for perishables, 365 days for consumer durables, etc., and 30-day for the rest of the items. This was what was agreed upon, and such that starting 2011-12, and there were surveys done in 2004 and 2009-10, 2011-12. Bottom line, by the end of 2011-12, the official method of measurement of consumption in India was a 365-day, was the modified mixed recall period. Now, the World Bank continues to do and it's hoped that they will change, but they continue to use the uniform recall period, which was there in the 1950s. And I hope Amitabh can answer to that question as to why they are doing. Now, there's some other rather important differences in the measurement of poverty of the World Bank. And the World Bank, remember, does it through POVCAL, which is global. And this had come up in discussions of our paper, and some of the commentators had said that we hadn't included interstate price differences. Now, it so happens that we have very much along, as per the Tendulkar poverty line or Tendulkar method, included the interstate poverty, the price level differences. The World Bank does not. The World Bank does not include it. All it has is a uniform price rise for rural areas and a uniform per year price rise for urban areas. They do not, let me emphasize, include any price differences between states, just between rural and urban. So an urban person in Bihar faces the same inflation as an urban person in Kerala. Then we have another rather important point that has come up in the context of our paper, is that, and everybody in India has commented on it and say, look, we did not publish the 2017-18 survey, and therefore we can't really rely on whatever estimates we have done or other people have done, because we need an official survey. I want to remind our listeners as well as Amitabh, I didn't know this before. I had an inkling, but did not know that in the case of the other big developing country called China, that the World Bank does not have access to unit level data. All they have access to are rural ventile consumption and urban ventile. Ventile is every 5% consumption. That's all that the World Bank has, and we don't even have that. I mean, the World Bank then processes it and does several assumptions in order to arrive at a poverty estimate for China. So we have to keep that in mind when we discuss the plethora of data that is available in India, and yet there are critics that, look, India does not have data, and all I'm asking for is that it has to be looked at in a comparative context, especially from the perspective of the World Bank. Okay. Now, recall period, very simply, recall period matters. In 2011-12, which is the last official survey that's available, that the average consumption, no poverty here, average consumption estimate was 10% higher when you did the modified recall than when you did the uniform. Now, obviously, that leads to led to about a 10 to 11 percentage point difference in poverty. 23% is what the uniform recall period that the World Bank uses gives you, and 13 is what you actually get from the modified mixed recall period. We need to worry, and we need to ask, and Amitabh, please try and attempt to answer as to why the World Bank, which is a referee of global poverty, still uses a 30-day recall period in its official publications for all the years, including 2011-12. Then now, this is just to document that basically something else that people need to keep in mind, that the official method of measuring poverty in India until the mid-90s was to take the distribution from the survey and take the means from the national accounts. And, this is what was the official method. And then it changed in the mid-90s. And there isn't any wasn't any real explanation given for it. One other difference that has come up by the critics and by the critics of our study, saying, we are using national accounts data. That is a very ill-informed statement. What we do is we take the actual and the practice that we have done for this estimate of poverty is exactly what the World Bank does when it does not have data. When it does not have data, household data, and remember, basically every country has at least 3 to 4 years between the household surveys. As I mentioned to you, in China, you don't have the data anyway. But for the other countries, when you do have the survey data, they use the survey data, and hopefully they use the correct recall period. And when you don't, you extrapolate from the survey the growth in consumption as given by the national accounts. The growth in consumption, not the consumption. So there are experts, and I'm rather surprised and embarrassed that experts who worked on this say that we use the national accounts estimate. Now, the national accounts estimate is twice that from the survey. We have not used, otherwise we'll have negative poverty, zero poverty. We do not use the national accounts levels. We use the national accounts growth rates for years for which the survey data are not available. And that is exactly what we do. And that is exactly what the World Bank does to provide estimates of poverty when the survey is not done. Okay. Then this is, the other estimate that we have done, the other method, or not the method, the other attribute of our discussion, this is that we use the growth rate, and the growth rate is very, very conforming to actual measurement. And this I want to get to, this pass-through factor. Now, what is the pass-through factor? The pass-through factor is how much of the growth rate in actual consumption is attributed to households. In other words, if the national accounts show that there's a 5% growth in a year, and you do not have survey data for that year, you assume that all households have their growth increased by 5%. Okay. Now, the rural and urban differences, but let me just point to this. Now, this is what the World Bank does, and the pass-through is 1 for every country in the world except for India. Okay? So let me make that very clear. The pass-through is how much of the growth in national accounts, PFCE, is attributed to households in years for which there is no household survey data. That pass-through is 1 for every country in the world except for India. And for India, the pass-through is assumed to be 0.67. Why 0.67? Because some experts at the World Bank had written something in 2000, looking at data prior to 2000 for all the countries, and had found out that the pass-through from surveys, the survey growth rates in consumption did not match the growth rates in in national accounts consumption, and there were averages, and all the countries had much lower than one pass-through. Okay, so, but let us look at, and the point is that this involves a deeper study, that what we need to find out is why has the pass-through now stabilized in India and in other countries, mind you. And previously there were new items being brought in. Remember, this is for developing countries. This is not pass-through for developed countries. But I just want to get back to this, that what you have, the average pass-through in all surveys in India from 1973, you look at the nominal consumption growth in the survey, and you compare the average consumption growth as per the national accounts. And broadly, it is around 80 or 90% average. Okay? Now, in 2004-5 is when you had an average less than this number, and somewhere around 60. Okay. Now, actually, there's an aside to this, and if we discuss trends in poverty, this means that poverty estimate for 2004-5, the official estimate, was artificially higher because they captured so much less of the national accounts, which means that when you compare trends in poverty reduction, that 2004 to 2011 will show an artificially higher reduction in poverty than actually occurred. But that's for us to perhaps discuss later. So there are implications on the pass-through. The simple point I want to make is that we have assumed a pass-through of 1 for 1. The average pass-through in India in all the surveys since 1973-74 is around 0.9, and that the World Bank assumption for every country in the world is a pass-through of 1, which is what we have done. Okay. Now, then, there are in-kind subsidies. Yeah, I'll just take a couple of more minutes. In-kind subsidies, which have been detailed in the paper. And what has happened about food transfers is that we have had the PDS system since the late 70s, actually. And as you know, the PDS system was heavily criticized, including by me, including by Arvind, and perhaps including by Amitabh. I don't want to put words in your mouth, but it was very inefficient. There were a lot of leakages. And what has happened now with technology and the administration is that the leakages, according to several studies which we document, that the leakage has really, really come down. But we still assume that the leakage is around 86, around 14%. Last point I want to make is alternative estimates for the poverty in India by the World Bank. And there is a study by Newhouse Vyas, which comes out with 14.6% for 2014, which is exactly our estimate of 14.6%. And one of the reasons we are that similar, near identical, and this is by the uniform recall method, is because they use survey growth from the social expenditure survey, etc. This for 2017, you get 10.4 by the World Bank, and we get 7.2. And almost the entire difference can be explained by the pass-through factor being much lower in the World Bank estimate than in ours. So what we know is 2014, our pass-through method of 1 for 1 exactly matches this. And but perhaps we can leave this for discussion. I just wanted to point out on this. So I'll stop here and look forward to Professor Kundu's comments.
Actually, is Karan there?
Karan has joined.
This audience has not read the results. I would have preferred if at least some of the results were read out. Karan, are you there?
Karan is there.
Karan,
Karan,
can you just take us over the results? We have a general audience which may not have read the paper.
Yeah. Okay. The results are basically the following. And there's a poverty study, parallel poverty study by the World Bank, which is based on CMI data. And I don't want to go into.
No, Surjit, just stick to the results of our paper. No other thing now. Just the results.
Exactly. Yeah, that's what I was. So anyway, what I want to point out here is all the way from, just look at the 1.9 PPP poverty line, and we present the estimates for both the uniform recall, which is now a discarded method of poverty measurement in India, and the modified mixed recall. And what you have is that after you adjust for food transfers, the food transfers actually add about or reduce poverty by about 1 to 2 percentage points. Okay, just to get a broad idea of how much they do, and obviously later on. So our estimates of poverty, and our paper presents estimates of inequality, etc. Incidentally, on inequality, and this is another misconception about our study, they say, how are you getting distribution differences? Because you take the 2011-12 distribution. Now, that is only partly correct, but different states have increase in expenditures, and different rural areas and urban areas have different increases in expenditures, and therefore that allows the distribution to change. So it is not fixed at the 2011-12 level. Second, on the levels of poverty, and this is, we give both the estimates of uniform recall and modified recall. And what you find is that while the difference in 2011 was about 10 percentage points, in 2020 or 2019, it was only 1 percentage point, which leads us to our, in the paper we discuss this at length, that the time has now come for India to move to a higher poverty line. And this is very conventional practice. Countries move to higher poverty lines. And indeed, the World Bank itself has a guide that once you become lower middle income, that you should have 3.2 PPP. And by all accounts, India is now lower middle income. And that is another important result that we say that we have to move to a higher poverty line. Remember, and I find it somewhat strange that in India, in 2004, we moved to a higher poverty line, which was higher by about 18 percentage points. And I don't remember, but maybe Amitabh can correct me, about a hoo-ha about raising the poverty line then. And I find it, that the people or critics are still saying, oh, how can poverty be low in India? Now, remember, you choose your poverty, whatever level of poverty you want in India or you think India has, and then choose the poverty line accordingly. You want 50% poverty in India, then choose 5 PPP dollars a day, and so on and so forth. So, your definition of the poverty line yields the result, whichever you might want to have. Our point here was that the most important poverty line for a poor developing country, which we were once, is the extreme poverty line, is the lowest poverty line, which is 1.9 PPP dollars per day. That is why we are concentrating on that. And that we find a singular achievement in India that we have been able to eliminate extreme poverty less than 1%. Mind you, China, um, and looking at the data provided by the World Bank, eliminated extreme poverty in 2016. And so India has done it at a per capita income level correspondingly, about 1/3 to 1/4 of the achievement of whatever China has done. And this has been well documented. The inequality in China is considerably higher than inequality in India. And second, what people forget is that the average consumption level in India, official accounts, not even survey, is much lower than the average consumption level in India. India, it's about 60, 65. In China, it is about 45 to 50. So there are very good reasons why India has been able to be remarkably more successful than China in eliminating extreme poverty. But maybe I'll let Amitabh and some questions. Then
Thanks. Basically, Surjit has focused on methodology. So before I turn it over to our discussant, so let me just make some general points. It turns out that I was in the Planning Commission for most of the period when these controversies took place. So the NAS-NSS controversy I was personally involved in. The whole move from URP to MRP to MMRP, I was in the Planning Commission and part of that period in charge of the division which does these calculations and so on. So in some sense, it's kind of when Surjit went into investigating subsequently the World Bank, what World Bank has been doing, it's really surprising because they were familiar with it. We had argued about all these things. In some cases, they won. I still remember when they moved from multiplying the consumption, the NSS consumption by the NAS and adjusting it to the NAS level, which was way in the 80s or somewhere. And they insisted that we stop doing that. And of course, they won. I lost. I argued against it. In the URP, MRP, MMRP case, I was pushing it. I was driving the move to this. It seemed perfectly logical and simple to me that, if you ask 500 questions and you expect a person who's being interviewed to tell you everything in terms of 30 days was really absurd. Whether once a year or he bought, let's say, a bicycle, or he bought clothes twice a year, everything into 30-day averages, right? So it seemed logical and simple that commodities you buy kind of every day, like milk, like rations, the poor buy them virtually every week, that the 7-day recall period was best, saying, okay, how much did you spend on milk, grain, etc., in the last 7 days? And on the other extreme, people were starting to buy coolers. So, how did you buy a cooler in the last 1 year? I mean, did you buy something in the last 30 days? That's absurd. He will not have bought. I mean, of course, there was a statistical method for estimating it, but at least in terms of, imagining, if you thought it was a perfect world where everybody remembered everything, yes, there are statistical ways of dealing with it. But if you think of the reality, there's a poor guy who's answering all your questions, 300 of them, and you expect him to remember everything, over a period of 30 days. It's just, it was obvious that we should switch over to a 730, 30, 365. And just one more thing to mention, when I was, the last estimates, I believe it was 2004-05, were made actually in the division which I headed at that time, where the previous person had moved to the Statistical Commission, where Surjit and Dr. Kundu probably interacted with him. My predecessor who moved to the statistic department and then statistical commission. But at that time we didn't realize or didn't have the procedure. We applied the standard procedure. We were not accounting for what we call in-kind transfers. And really this point struck me very deeply when around 2018-19, Jeff Hammer did a survey. He's a professor in the US on portraits of the Indian middle class. And suddenly I realized, and it's an interesting story before I come to Dr. Kundu, that, if you had a urban person who owned his own house and who rented it, the owner occupied would appear poorer than the rented one, everything else being equal. Strange, right? Why? Because he was receiving his own rental income, so to say, it didn't appear in the accounts. So actually, his expenditures were lower. So in the poverty estimates, he would be poorer than the person with everything else the same, but was renting the house. So this in-kind transfer thing, I realized is kind of critical. So that was one of the reasons why we tried to estimate. Unfortunately, of course, we only had the time and to do the PDS, but of course, this can be applied to other things like subsidized LPG, etc., etc. With that, let me ask Professor Kundu, let me just introduce him and have his comments, and maybe I'll come back to Karan to give some more results. Karan, why don't you think, remembering that these are general public, some of the results which may be of interest to them, just highlight them a little bit for 5 minutes or so after Professor Kundu has commented. So let me introduce Professor Kundu, who's our discussant. He has been professor and dean of the School of Social Sciences in Jawaharlal Nehru. We are very fortunate to have him as a discussant. And he is, of course, as Surjit mentioned, he has been on the National Statistical Commission. He is currently a senior fellow with the Sustainable Cities and Transport Program. He has worked extensively in the urban field. With that, let me hand it over to Dr. Amitabh Kundu.
Thank you. Thank you, Arvind. It's a privilege.
Stop the sharing, Amitabh?
Sorry.
Should I stop sharing the screen?
Am I audible now? Okay.
Yeah, Surjit, can you stop the sharing and we can put it back if Karan needs it?
Yeah, I'm just trying to stop share. Oh, there should be something. Oh, stop
right
share.
top, I can.
Yeah, go
Okay.
ahead.
Right. Go ahead.
Yeah.
Okay. It's really a privilege for me to share the platform with three stalwarts who have started this new poverty debate in India, being talked about not only in India, but different parts of the world where poverty analytics have taken shape. And well, I must tell you that I am very impressed by these studies done by Arvind, and I have read some of Karan's work as well. I used, in fact, the vision document, Arvind, for making a projection of urbanization, three different scenarios, the work that Professor Charan Singh asked on behalf of EGROW Foundation, which is under consideration of NITI. I'm also grateful to him for getting this opportunity. Let me make three small clarifications. First is that we are aware of the problems of URP, and we have discussed it extensively in India in different platforms. And why, despite all that, the World Bank is going ahead with uniform recall period. I'm not the best person. I mean, I'm sure Arvind and Surjit can tell us more why this is happening. So I have absolutely no problem. I use MMRP, and that's what I have accepted as being more precise. The second point, the criticism which is made of this paper, that Angus Deaton has said that private final consumption expenditure from NAS should not be used for estimating poverty. They have not done that. I think it's made it very clear that only using the growth rate to update the consumption expenditure. Otherwise, poverty would have been zero in 2004-5. The third point that is being talked about in the public domain is that distribution remains constant by the method of extrapolation and interpolation. This is nonsense. It doesn't remain constant. There are certain changes which have been brought in the distribution because the urban-rural location, the prices are coming in at the state level, which makes an impact on the distribution. And also the state level nominal income growth has been brought in to really upscale the consumption expenditure of 2011-12, which has been taken as a reasonable, robustness. And that certainly I am with that. I must tell you, as I was reading through 5 different chapters and the 3 long appendices, I was getting a feeling that I'm entering a fort, like a chakra vyuha, where the pillars have been made, supported by either recent data which have robustness or some recent studies. So you walk through that, and as you go with the arguments and the way you finally come to this spectacular conclusion that the poverty in India is 0.8%, even during the peak year of pandemic. Now, spectacular. I must say that I'm very impressed, and although this has created a lot of discussion, I'm impressed that, well, by the methodology that you have done it, and if once you are into it, you come to this conclusion. Dr. Virmani's vision document I have used, as I said, in my projection, and with Surjit, we have been colleagues, but I don't know whether you remember, Surjit, first time I met you, I wouldn't say I met you, I saw you, was when you gave a lecture at Jawaharlal Nehru University. Professor G.S. Bhalla, the senior Professor G.S. Bhalla, had invited this young person from the bank to give a talk to the revolutionary students of the Jawaharlal Nehru University, and we are very impressed. I'm remembering Professor Bhalla because at that time, myself and Professor Bhalla, we are working on a simulation model. He had prepared Punjab's input-output table. He had inter-industrial flow for Punjab. We thought that we don't have the data for Bihar and for Uttar Pradesh. Is it possible to take the input-output coefficients or the inter-industrial flow matrix of Punjab and change the rows and the columns by the figures that we get from Bihar, and then start simulating, adjusting, the coefficients to match the row totals and the column totals which are getting from the 2 different states? I must tell you that the exercise that this study has done by the 3 stalwarts, at least when you're talking about convergence with 2004-5, your interpolation, it is partly similar to that. But certainly, the adjustment that the Roy and Ray has made using the CMIE data is much similar to that. What they do, they pick up the CMIE data sample, and it is very well known that it is not very representative of the Indian situation. John Race has written about it, and many others have written about it. So obviously, you take that CMIE data where in many of the parameters, the percentage of households having access to basic amenities, television sets, 76% against the other NSS data of 26%. Obviously, there are anomalies. And to give credit to the authors, they make adjustments. They change the weightages because this is not matching. The CMIE data is not matching with the data sources available, which are considered to be much more reliable and robust. So they do these adjustments. And by doing the adjustment, they come to the figure of 10% or 11%, which I must tell you, many Indians from this side of ideology or that side of ideology find it acceptable. Take care. 22% coming down to 11%, fine. They wouldn't bother too much about the methodology. And I must tell you, if they would have further tried to reconcile with some other anomalies, they might have got a figure close to 13% or 14% that would have made others also very happy. That, of course, there has been a real growth of GDP during 2014-19. Poverty must have gone down. It has gone down. But as far as, Surjit, Virmani, Karan's, Chakra view is concerned, which is managed in a way. The Chakra view is managed by Dronacharya, Bhishma, and of course Karan. Then you find very difficult to accept the figure of 0.8%. I have not seen much discussion on the methodology, but the discussion is, how come zero poverty? This is impossible. And there are arguments which have been made which are somewhat unreasonable also. For example, to say, how come there is no poverty, less than 1%, when migrants are walking thousands of miles? How come there is no poverty when people are dying on the road during COVID period? How come there is no poverty when 40% of the women above 5 years of age in FHS 5 data shows they have never gone to school? How come that 35% of the women never have these mandated prenatal, checkups? This, of course, you can dismiss, saying that, look, we are talking about poverty. We're not talking about the whole structure of the social sectors. Fine. But there are points like, how come 55% of the children are anemic? How come 45% of the pregnant women are anemic? How come the 30% of the adult males are anemic? This is coming from NFHS 5. That has been mentioned. I would like to give some weightage to that, but nonetheless, I'm quite sure that the three stalwarts would say, look, we're talking about poverty. Poverty and nutrition are not the same thing. Nutrition at the household level is a function of so many social parameters, distributional parameters. You can't just look at the nutrition data. There is a methodology for calculating poverty. You must understand that methodology for calculating poverty. And frankly, this has been, at least in the Tendulkar's report, they were delinked from the calories. And you can't really try to argue against the poverty data because there is a distinct method of measurement. You have to look at that, and then obviously the linkage between nutrition and poverty figures can be tenuous. I would just leave that point at that, and I would move to the methodology part. But before that, I just want to mention one point, Surjit, for your consideration, and Arvind. I had just joined JNU as a young lecturer, and I was listening to the debate by the stalwarts. And I remember Professor Lakadwala telling Dr. Minhas was saying, look, it depends. Calorie requirement depends on the individuals. I mean, there are a number of studies, and it's not possible to really link up calorie or link up nutrition with poverty figures. Lakadwala, after listening to him for 2 hours, he said, Bagich, poverty word has a punch, has a force in the policy debate at the national and international arena. And why that? What is the source of that punch? It comes from the fact that somehow people think poverty means deprivation. Poverty means suffering. Poverty reflects struggle of the people to survive. Now, once you're really dealing completely from calories, nutrition, do you think that the place that poverty has in the national and international policy debate as a matter of calculation, if you have totally lost touch with the nutrition, would you be able to have that status of poverty in the policy discussion? I entirely agree that it's not possible to say, let's go for multidimensional poverty, because there are problems of weightage. You take 10 indicators, how you put them together, it will be very difficult to have some kind of a consensus. But I would like to appeal to the three scholars who have authored this report to consider that is it possible somehow, not just to say 1.9, make it 3.2. Let's find poverty figures coming up. Is it possible to somehow have consensus on a methodology which is capturing the suffering of the people and the struggle for survival, people's dignity. Is it possible? Because it's very easy to say the methodology doesn't capture this. There's a delinking. If people are consuming alcohol instead of taking food grain, it is their problem. Poverty is not interested in that. I think that is the issue that I would like those who are guiding the national and international debate on poverty to see that whether there can be some linkage. I come to the point which has been raised in the media about this study. Yes, I think rightly mentioned about this NS methodology of updating the consumption expenditure, interpolating or extrapolating. I think the authors are raising a valid question. If this decade has been disastrous for, in many senses, for the data also, what else do you do? And different countries have been using the NSS data. So, and I mean, there can be the pass on factor, how much of it is captured, we can debate it, but what is the way out? You know, you have NIS data. I was very happy to see in these slides, you also talked about the income data, which can also be used, considered for, extrapolating or interpolating. Now, I would ask that since you are bringing in the distributional changes, do you think that the only way to bring in the distributional changes is to take states as the basis for differentiation? You are assuming that Mr. Amba Prasad living in Bihar in rural areas, is having similar kind of a distribution within Bihar in the urban context. And in Gujarat, within the urban rural segment, the distribution remains constant. I was just wondering, I mean, I've been thinking about it for quite some time, but is it not possible, I didn't have that kind of resources, to have some disaggregation of commodities for NAS? I looked at the data for the last 5-6 days. I was looking at it. We find that different items which are going in. Of course, there are criticisms that the unincorporated units are also included in the private final consumption expenditure, and hospitals, non-governmental organizations, if they get some amount, that is included, and if that is passed on to the household, there is a double counting. I'm not getting into that issue, but I'm saying, is it not possible to update each household's consumption expenditure of 11-12 by any other factor, by different commodities? I mean, can't we, or at least a group of commodities, 10 or 15 you take and try to adjust? That is one possibility which I would like the authors to examine. And second point is that you can also identify the households. We can identify the household by the economic activity in the consumption schedule. So once you do that, and if you think, we don't have private final consumption expenditure by economic activities, but we have income growth rates. So I was just wondering whether we should only restrict ourselves for this update, interpolation and extrapolation to the state level figures and rural urban prices. Is there any other way of effectively bringing in the distributional changes? That is my first submission, because I personally believe that to say NAS data should not be used, I mean, that seems to be taking us nowhere. But can we just improve this, bringing in the other parameters which can bring in the changes in the distribution? Because the growth rate of the unorganized sector, organized sector have been very, very different, and you can make out by different subsectors and the even items of consumption. The consumption basket will be very, very different across the states, and the poor and the rich. So I was just thinking this possibility can be explored. The second point that strikes me, and I think Surjit, you have answered it, how come the growth rate of consumption expenditure in the period during 2014 to 19, where the income growth rate was less compared to 2004 and 11, how that come the consumption expenditure has grown at a very rapid pace? but higher than the earlier period when the income growth was higher. And well, there are issues, and one feels little unhappy because unemployment rate was slightly higher, but to say that it was going up consistently from 2014 to 19, I don't think I would support that. But the real wages, for some years it was negative, it went down, but it also increased marginally. So there are some jarring, of information. There are some rough edges in this, and this is one conclusion which needs to be strengthened, and if there can be something more to strengthen this point. Final, I must congratulate this team for bringing in the fact that the state has an important role in provisioning of certain items for the people who are vulnerable, who are below poverty line. And once you're doing that, there has to be either adjustment of the household level consumption expenditure or the poverty line. Because if the role of the state is changing over time, the poverty line is defined by accepting certain level of operation of the state vis-a-vis the household. If you have, after NFSA, National Food Security Act in 2014-15, the PDS offtake went up. Household purchase about double of what they did before that. And in 2020, after Prime Minister's Garib program Yojana, again the PDS offtake went up. So certainly, why shouldn't we do that adjustment? Why shouldn't we do that adjustment for, let's say, Ujjwala Yojana? We have gas being given free. So certainly, I have a feeling that the engagement of the state in giving the facilities, providing the facilities to the household level must be taken into consideration. In fact, I've been asking some of my students to say that let us either adjust the poverty line or adjust the household expenditure depending on the changing engagement of the state vis-a-vis delivery of the different facilities. So if that is the case, that raises a serious issue which needs consideration. I don't know, calculation wise it would be quite difficult, but the point is there has been withdrawal of the state in education and health. And we have NSA data to show how the out-of-pocket expenditure for the primary education, for the secondary education has gone up. So there has been, in a way, the state's withdrawal. If you're talking about states' increased engagement, yes, I think gas, Ujjwala Yojana, Prime Minister's Garib Kalyan Yojana, they have to be taken in. But should we stop at that? Should we have at least this concern in our mind that withdrawal of the state should also be reflected either in changing the poverty line or changing the consumption expenditure? One minor point that I would like to mention, your paper mentions that average consumption of food grains has been about 10 kilograms. And if the household is getting, the individual is getting 5 kilograms from PDS and 5 kilograms free, so the person doesn't have to buy anything from the market. I would simply say that the studies for 4 major states by IFPRI shows that even in 2014-15, the households that were entitled to PDS did not buy anything from the market. Because average is one figure. There were many households below the average, which really means that in 2020, many households may not be needing that, or if they get it free, they will take that free, but then they will not get the PDS thing. Basically, the point is that the households which may not have taken that offtake that you are calculating from the Reserve Bank of India figures, that you have done it. I like it. Do you find that the actual offtake from the PDS and actual delivery, but there has been a leakage food grains going to the non-targeted households. And one is not very sure whether that leakage which went to the non-targeted household because of the liberal and a very positive and humanistic approach in the distribution of PDS, that could have gone up. Because many people at the middle, not below poverty line, also without, I mean, I know many people went without an identity card, Aadhaar card, and got this. So this is one thing. And secondly, to assume that if they had more grains from PDS and Garib Kalyan Yojana, 9 kilos, and they only consume 5 kilos, the food consumption per capita has gone down from 2011-12 to 2020. As one would expect that as the income level goes up, cereal consumption per capita may go down. Now, if somebody had extra 5 kilos or extra 4 kilos, to assume that that person would dispose it off in the market and spend that money in the poverty basket expenditure, I think that would not be correct. Again, I am giving you the field experience from Chhattisgarh and Jharkhand. You find that many of the people who got extra food grains, they dispose it off in a very casual manner. Sometimes that, take alcohol consumption, they did not get the market price. So this is something that bothers me, that when you are making the adjustment, you are taking 30 rupees for rice. And if some household, I mean, this IFPRI study shows about 48% of the households who were entitled to PDS food grains in 2014 did not buy anything from the market. If that is the case, then I have a feeling that extra 5 kgs or even 2-3 kgs, that you cannot really perhaps price it at the market. That is something that I would like you to really investigate. I think I have covered the basic points. I'm really I must congratulate this team for pointing out to some of the very important, innovations which are possible, and certainly one should explore it, strengthen it, and see how we can move forward. Thank you.
Thank you. Thanks a lot, Professor. So I want to actually, just before I either call Surjit or Karan, whoever wants to come in, I think you raised one or two very important points which I want to actually say something on. In 2004-5, when I was in the Planning Commission, I did a study, and you raised, it's relevant to what your very important point. And what I did was, it's around the time of the 2004. So let me give you the numbers. What I found, there was still a question on hunger in the NSS surveys, and hunger was around 2% of the population as measured by the NSS. And of course, we know, and we have the numbers here now. I'm just going to use the ones from our study, and the actuals were roughly that. We had 32.7, or let's say 33% poverty rate. And if I remember correctly, the child malnutrition at that time was around double that poverty number, around 60%. Okay, so this is something which is not new. This is a very important point. We cannot, attribute. We can't look at child nutrition and say, oh, poverty is very high. We can't look at a hungry person and say, oh, it must be all over. Well, no, it was like, a fraction of what the poverty rate was. Right. So I think that's a very important point you made. But it's also important to remember the data, that these measuring very different things, and the numbers can be quite different. So we should not assume that if we get a number of, let's say, 0.5% for hunger, somehow the poverty must be 10 times that, or 2 times that. You have to measure these things by themselves and treat them by themselves. But you're very, very right. I think one has to, and as a statistician and a long time researcher, you'll appreciate that precision in measuring and estimating is very important. You have to define the thing properly, you have to estimate it properly, and not mix these things up. So that's a very, very important point, which I think is very, and just to see where it went, you can see 2011, we are not getting to our numbers. These are 2011 exact numbers, which for MMRP, which was 12%. So the poverty is already down from 32% to 12%. Now, if you look at it in that context, a poverty rate, this is before making any adjustment for in-kind transfers, 2019 is down to 1.4. doesn't sound very unreasonable. Okay, that's the first point I want to make. You come down from 32 to 12, roughly from 4 to 11, and from 11 to 19, you come from 12 to, let's say 2% roughly as measured without the food subsidy. I don't think it's outside the range of possibility. The second point, again, very important, where I'm sure later on you're going to give us your talk on pandemic, but a lot of people seem to have missed this. In my interviews on TV, it came up again and again. Our study does show a doubling of poverty if you don't take account of food subsidies. It's showing an increase from 1.4 to 2.5. It's a doubling. In the pandemic first year, in the next year, we don't know. Maybe it had doubled again. I don't know, because it was worse. It was a Delta variant, which was worse than the first year. So, but the point we make, which is very important for people to understand, is that the increase in food subsidy completely offset this increase. That's the main point. The increase did not happen after food subsidy. It remained at 0.8 from with food subsidy before and after. It remained unchanged. Not that there was no increase. The increase happened if you had left the food subsidy unchanged, or there was no food subsidy, there was certainly an increase, but it was offset by the food subsidy. So these are two, I think, very important points. I don't know, Surjit, you or Karan, now if you want to answer or take up any of the other.
Karan,
I just wanted to make a couple of quick points in response. Basically, first I want to begin on the distribution, since this keeps coming up a lot. That the methodology assumes the distribution to be constant, and that's not entirely correct, as even Professor Amitabh mentioned. But the point here being that distribution is of consequence when people say that the distribution has worsened. That's when you take this simple multiplication using growth factors, that there are bound to be errors in the estimation process. But all the available data that we have, whether it is from ISDS or the recent NSSO asset and liability survey, it all points at improving distribution. And that basically means that if indeed distribution has improved, then I think there is a good enough case for us to kind of use growth factors and assume broadly that the nominal distribution remains unchanged and still arrive at a more reliable, accurate estimate. The second point is on in-kind transfers, and I think the important thing here is not the assumption that we make that the person can sell it in the market, but it is to do with the fact that if you go and do a survey today, and if you ask a person how much money did you spend on food, and if they are indeed entitled to 10 kgs, they would of course report a lower consumption expenditure than someone who is not entitled to the food transfers. And that's exactly the problem with in-kind subsidies, that they basically result in a lower consumption expenditure, lower reported consumption expenditure. So it kind of messes up the entire distribution if you are using just the survey consumption aggregates without accounting for these transfers. And the other issue is that for a lot of policy evaluation, you do need these kind of data sets, right? So for instance, if you want to compare what happened to poverty uh, when you gave cash transfers and when you gave in-kind transfers, and you use this method without making these adjustments, your variable of interest or your key performance indicator itself is biased towards cash transfers, because if you do cash transfers, they will show up as consumption expenditure. So that's why in-kind transfers is a bit important conceptually and even definition from a definitional standpoint to be included when these surveys are conducted. It is, I mean, what we know so far is that the new survey will of course have questions on PDS transfers during the pandemic. So I think they will help us better understand about how to go forward with regards to dealing with consumption aggregates. And of course, the new survey will also have 3 visits instead of 1. So one expects a better accuracy in terms of measuring of consumption aggregates. But I think the disaggregated method for updating, I think that the marginal benefit of going into that granularity might not be that high. Given that we are looking at a change of approximately 9 years or so, more than 9 years, and over a very long period of time, as we have even showed during the presentation in terms of the pass-through factors, the assumption of a pass-through factor of 1 is not that unreasonable. In fact, it is very close to the long-run average pass-through of PFC to consumption aggregate growth. So I think these are some of the points that I wanted to add. And on targeting, it's a very valid point, and we of course also don't take a complete targeting factor of 1. In fact, we also take it in mid 80s. And incidentally, there are two more studies which also have a very similar finding. Allen Gelb, and there's also a World Bank study that finds that approximately 85 to 86% of beneficiaries actually did receive the food transfers during the pandemic. So I think again there also we find recent literature broadly consistent with the targeting assumption that we have used for our estimates. Now I think Surjit sir might want to add something to.
Thank
to
you,
that.
Surjit.
Yeah, thank you. You know, one, I really do, appreciate a lot of the points that Amitabh has made. And what I want to point out, though, is, and he's a veteran of these debates. Arvind is a veteran of these debates. I'm a veteran. Karan is now venturing into this minefield. But remember, in the 1980s, the people thought exactly on the nutrition point, and volumes of papers were written on measuring calories in order to derive poverty. And that, thankfully, was given up by the Tendulkar Committee. I don't know, Amitabh, whether you were part of that committee, but they rejected this. And I remember at the World Bank, I wrote in 1980 a paper, which the bank did not publish for interesting reasons, which showed that if you take the calorie measure, 85% of Americans were underweight. And what I did point out that any casual observer will show that if there's any problem in the US, it is overweight. So, and PV Sukhatme, again, we've had veterans and people who pointed the way, and PV Sukhatme showed that inter-individual variation accounted for most of these differences, So I think we have to be very, very careful alluding to different measures of, think of it, no matter what measure you come up with, there will be problems and we can nitpick. And notice just one, we are debating, you raised some interesting points about whether you're measuring properly, etc., or not, and maybe this and maybe that. The whole, and whether inequality, look, 95% of changes in poverty are accounted for by growth differences. Distribution is in the eyes of the beholder. It really does not matter. Empirically, I'm talking empirically, it does not matter. And, and again, the confusion is there. People have pointed out, scholars in the field of poverty, World Bank scholars, ex-World Bank scholars, oh, income distribution has worsened. We assume income distribution has worsened because all the leading guys in the world are saying income distribution is worsened. Well, we have nothing to do with income distribution. We're talking about consumption. And as you know, consumption is a lot more stable. You can't consume beyond a certain point. No point bringing in the Ambanis and the richest people in the world. Their consumption does not change. So please, not you, Amitabh, but the critics, you want to come up with a criticism. Let's be real. It's a simple thing that, look, according to this particular restricted definition of poverty, that's all we are concerned with in this paper. Very restrictive. But you know what? This is the only comparable basis we have for every country in the world. Now, let's settle this debate on the basis of the data. And the World Bank itself does not settle this debate. So this thing is an ideological minefield, unfortunately. Choose your poverty number, choose your objection. I'm not saying, Amitabh, you were very good. I'm pointing out all the other critics that you also referred to. That, why aren't we just a little bit more honest in our discussions? This is a limited paper which points out, I haven't heard one scholar mention about China, and we take that for granted. All this criticism about Indian surveys not being there, etc., lack of information. I mean, that's what I find honestly quite offensive about the Indian debate. And, there is a quote that I pointed out, and I think I discussed with Karan, and I've written it in another paper. In 2015, I wrote, every country in the world, once they achieve poverty reduction, extreme poverty, they celebrate. It's a moment of triumph for the country, for the culture, for the society, except in India. And so I think this is something for psychologists to determine. Why do we have these unnecessary debates in India? I mean, we like to, the fact that we are argumentative, that's okay. But why is it always, absurd arguments?
Okay,
So that's the
Surjit,
only thing I want to, yeah.
we are running out of time. Is there any specific point, Karan? Very quickly, let's take a few questions. Charan, if you've seen some good questions, or Karan, you want to say something in the meanwhile? We'll look for questions.
Yeah, I've been so mesmerized with the debate. I didn't look at the questions,
Oh,
but
okay.
I'm sure there are many.
No, I just wanted to add another quick point regarding the assumption that we take of the growth factor, so to say. Again, one thing is looking at the pass-through factor of long run averages, and we find something very similar. I think in recent work, Surjit sir finds that even the CMI pass-throughs are quite close to what we really have. And even the ISDS surveys growth that you find between 2011 and 17 is remarkably close to what we have. So no matter how you look at it, uh,
So,
if
right.
if you're looking at the
So I think,
MMRPs,
Karan, that's an excellent point that maybe when you and I, we have some, or Sujit has time, maybe we should
right.
make small tables and put them out into the blog or something to as a reference. Anyway, yeah.
Arvind, can I just ask one point?
Yeah, please.
I thought I would like Surjit to specifically respond to this issue, and you also to consider. If you are thinking of now updating or going ahead with the study, do you think that it is useful to consider any other parameters of, upscaling, interpolation or extrapolation of the consumption expenditure of 2011-12, other than state? Can we bring in any other parameter, either commodity-wise adjustment or on the basis of the economic activity? If you think income can be there, isn't that somewhat better way of approximating the distribution, simulated distribution? Because as I didn't mention that our results with Bihar and Uttar Pradesh preparing the input-output table was disastrous. It didn't work out. That is one thing. And secondly, to say that the entire extra amount that came during 2020 under Prime Minister Garib Kalyan Yojana can be valued at the market price, I'm just wondering whether that would be okay, or can there be some minor correction?
Good
But
point, question. Sujit, you want to take these up or yeah?
And the third point is, do we take this withdrawal of the state from the provision of some of the basic amenities to be also a factor if you're taking state's engagement to be brought in the poverty calculation? What about withdrawal in education and health? That's, I thought, is there any way of that you can think of incorporating it? These are the three questions.
Yeah. Okay. Look, one, and I want to then first on wages. we have done a study, and we refer to that study, the results of that study, that one very profound thing that has happened in India over the last, since 2011-12 and the PLFS surveys, is that the wages of casual workers, which if anything would form a larger fraction of the poor than salaried workers, the wages of casual workers have gone up in real terms, and the wages of salary about 1 to 2% a year, as well as the wages of salaried workers, as per the PLFS surveys, as per NSSO, has stayed constant or gone down marginally in real terms, using the deflators, using the price indices. So this is also very consistent with the result that we've got. Second, I see that, Indra Herve has a comment, and I'm very, I actually am using, she was a pioneer in the study of labor force participation on education. And I'm using that study to show that the definitions matter a lot in terms of labor force participation rates. But that's an aside. What she has pointed out in the chat box is on education. And, look, one of the big success stories in India over the last 30, 40 years, especially the last 20, has been the expansion in education. Now, I've talked to the Pratham people, etc., and the quality of education is obviously, and this is pre-pandemic, so pandemic quality of education also worsened, obviously, and that's another story. But basically in 1980, what has happened in India is there's been a large expansion in education, enrollment, that all the data confirm. Quality has gone down. Just remember that in the US, when it went through the same kind of educational expansion post-war, that in 1980s, and I'm sure several of you were in India, that were at some point in time in the US, the phrase was, Johnny goes to school, but Johnny cannot read. That is not much different than India circa 2020. Sita goes to school, but Sita cannot read. The other big story in India.
लॉ बिल्डिंग में ये अपने हॉस्टल के सामने ना कोई बिस्किट का पैकेट वगैरह लेके आ जाए.
Please mute yourself, whoever's watching.
Yeah. So and another study that will soon be published, you look at the wages. This is PLFS data. Look at the wages of women, girls, etc., less than 34, and of salaried women in India and salaried men in India. And you find that the two are equal. We are about the only country in the world where salaried wages for women and men are equal. Okay. So I think the education story is a huge story in India. And what happens is that if you look at the wages, the salaried workers above 34 years of age, you find that women are earning about 10 to 20% less than men. Right? They also had 1 to 2 years less average education. So once you control for education, wages in India, salaried wages, are equal between men and women. And I like to see anybody point to any country in the world with a similar kind of a finding. So I think, there's a lot of way to go for India, but I think there's a lot that we can be proud of having achieved. One of those is to eliminate absolute poverty. The other, Amitabh, you're absolutely right, the role of the state. as in poverty reversal, which was always assumed to be there and was there, and take the PDS, what Rajiv Gandhi said in 1985, that only 15% of the money meant for the poor actually reaches the poor. That was in 1985. Today, you have about 70, 80, 90% of the money that is meant for the poor reaches the poor. The state has really improved. And that has affected our calculations, our estimates, and our thinking, and our estimates of poverty in India. So this is, let's recognize from where we've come. The unfortunate assumption in India is that we are the same. The debates in India is that we are the same as in 1950. At that time, we were $100 per capita. $100. Okay? So all I'm pleading for is a recognition. Please don't apply, I'm above 70, Arvind is above 70 people. The assumptions that we had and the world we saw was very different. And I think on poverty, this is very relevant. We have new problems. Absolute poverty is not one of them. And on poverty redressal, please recognize the data is all, we're just finishing a study comparing the different countries in the world, that India has done remarkably well. Could it have done better? Absolutely. But let us at least recognize we've done remarkably well.
Yeah, thanks, Surjit. Karan, very quickly. Yeah.
On the third point, since you mentioned that withdrawal of state from health and education and how to accommodate it, the basic premise that we are making is that with in-kind transfers, it doesn't get accommodated in consumption aggregates, and that's why we make the adjustment for food transfers. My understanding is that if there is withdrawal of state and people are spending more on health and education, that will automatically show up in the consumption aggregates when you do the survey. So if any adjustment has to be made, probably not with respect to the consumption aggregate, but maybe adjustment to the poverty line would be more appropriate in that case. As far as PDS is concerned, it's not so much that they can go and sell it in the market, but more importantly, in the absence of these transfers, they would have had to buy from these commodities probably from the market to get the same kind of consumption that they're getting after receiving these food grains. So that's the reason why we use the market rate. Of course, you can assume that the quality differences are there and make all kinds of adjustments. But broadly, I think since we are more interested in a comparison of before and after, even with food transfers. So I think it shouldn't make much differences when you're looking at over a period of time comparison rather than at a point in time.
So of course, Amitabh, your question is valid, question of resale, etc. But I think it's very detailed. Let's leave it at that.
But listen, whether you make adjustment in the consumption expenditure or the poverty line, it's the same thing. I mean, you can't have engagement of the state should be considered, but disengagement should not be considered because it's methodologically difficult. I understand. But nonetheless, this is an issue that you have state coming in a big way in food.
Right.
So certainly the adjustment has to be made, and I appreciate that. But only thing is that whether the amount of money which is being shown, 192 rupees, is that being calculated on the basis of actual, a receipt for the poor? Because non-targeting might have, the experience shows that the middle class people got bit of the subsidized free food also. So one has to be a little careful about giving some monetary value to the extra food which has been given during pandemic. Sorry, I don't want to take more.
Yeah,
One second.
The only issue
Very
is
quickly.
about resale,
On the middle class getting it. One second. On the middle class getting food, that doesn't affect the poverty calculations. Okay.
Yeah, that's the point. If the higher income,
middle class getting food does not affect, but showing that money going to the poor, that affects poverty. Because the total amount that you have given for you are assuming that the poorer households are able to consume that entire amount, but they are either not getting it or disposing it off differently. That is an adjustment which needs to be made.
Separate point. Sorry,
getting it is already adjusted in the.
Look at the
data. Actual data on consumption. PDS availability to the poor households. We
Yeah,
are
yeah.
assuming on the basis of mass
Amitabh.
distribution. That is my point.
Amitabh,
Hmm.
in 2004 and 2011 and in 99 and all the years prior, you actually have in the NSS surveys, how much did the poor get of the subsidized food and how much did the rich get, non-poor? And there was massive, we present that data, there's massive leakage. The rich certainly got it. So that's not the issue. The question is, has targeting improved? And we see in the NSS data, household data, no assumptions, that from about 32% targeting, it went up to 53% targeting. Why aren't you questioning that? How did it go? This is NSS data.
That's the answer, Surjit. That's the answer we were waiting for. That's the answer which was needed. Okay. The targeting has improved consistently from 2004 to 11. That's not our data. That's the NSS data.
Yeah,
And
NSS.
that is projected forward to get a number of 90. You can disagree with that and say it's less or more. That's okay. Let's leave it at that.
I have no problem with that. I have no problem. But valuing at rupees 30, the extra amount of food
Yes, Amitabh,
is
please
something
listen
that
to me.
needs to be
That is an
considered.
issue of
That's it.
resale.
Okay.
You are saying if they get 10 kg,
Fine.
do they resell 2 kg of it? And you are evaluating that at the market price. But if they resell, they sell, I got the thing. But that's not.
Amitabh,
I understand. Yes, it's very difficult to find out
Amitabh,
what
very
price they are
interesting.
reselling or
That
using.
affects
Fine.
1% estimate of poverty, 1 percentage point. Why aren't you questioning the World Bank, where just a different definition affects 10 percentage points of poverty? Here we are spending all our time on 1 percentage point. That's my point. Please.
I thought this
I know you
discussion
agree.
excludes. I didn't even comment. I just mentioned about their methodology. I said that my adjustment for Punjab, sorry,
But that is my point.
methodology
We
I don't
spend
accept.
all the time on
World Bank's
minutia.
methodology.
Stop. We've had enough of that discussion, and it's very clear what the issue is. We can have an offline discussion. I do want to take a few questions, Sharan. Is there any question which you think merits some answer?
Actually, the question by Indra Hirve has been taken, and I think broadly we have covered there in the chat box, the ones which are in the chat box. I think broadly we have covered it.
Okay.
I don't know if from the audience somebody wants to ask a question, if Dr. Vishandas or Nandu Sanyal, who have been working on these topics, want to ask a question. For me, it was a great learning experience.
Okay. Anybody want to ask? Or we? Okay. Now, last comments. If now we can do it. Okay. If you have a last comment, Karan, why don't you start first? Then.
No,
Dr.
so
Kundu, if he wants to, yeah.
So I'm circling back to the withdrawal of state point again, because see, the point being that if we are using consumption expenditure as the method of doing it, right? So we are interested in how much money people are spending, and by that logic, even if there is withdrawal of state, or if people are willing to go to private schools and so on and so forth, their consumption aggregates are going above. I'm not too sure how to uh, accommodate for that using the adjustment, unless of course we'll probably know more once the new survey is done, because they're trying to do something similar for health. But as of now, I'm not too fully sure how to deal with that particular issue.
Okay, thank you. Dr. Kundu, last words.
No, I thought that the next paper that should come from this trio should really have other parameters other than state level data and rural urban for making the projection. And I entirely agree that the calorie fundamentalism which has existed needs to be challenged, and Angus Deaton, as everybody has talked about it. But nonetheless, poverty has to have these sufferings built in. And how do you say the methodology captures that? Unless you have that, the the punch, the force that the poverty carries into the national or international politics may get diluted. So let's not really lose out on the sufferings part, which should be at the core of the poverty measurement.
Fine, that's your suggestion. I'm sure many people will take on board. Thank you. Surjit,
Okay.
final comment?
Thanks.
Okay, so yeah, well, it's been a nice discussion. I just want to end with, a global perspective. Countries move from lower income to lower middle income to upper middle income to high income. And the poverty rate which is applicable to a lower income country is not applicable to LIMC. So this is nothing unusual. As I think, one doesn't have to go into the politics. India is not unique, nor is China unique. We've all moved along this curve. I think what I find a little puzzling in the general debate is why, exactly like was mentioned earlier, why there is so much resistance. This is a particular measure. If we have moved on, we've moved from lower income to about 4 or 5 years ago. China moved about 10 years ago. Why is it that it's so unbelievable? Is very hard to understand. I think a normal person, an average person of the kind many of are listening here, would assume that we would do it. You have to prove that we didn't do it for some strange reason. So, I think that's the natural progression. Hundreds of countries or tens of countries have done it, and we have also done it. And we moved to another. We are now a lower middle income country. We moved to another measure of poverty. That's one. Second is multidimensional poverty. Yes, it's there. Planning Commission is estimating it. Perhaps we will do a paper on that at some time. But what I find is, I had this view. This is my personal view, is that many of these indices are for publicity purposes. I just don't see the value of having a human development index which puts in everything that they can find which is negative. What does it tell me? I'd much rather have an education comparison on an equal basis and then do something about education, or have a health comparison and do something about health. I really find, this World Food Index and these world indices, which are a combination, you throw in whichever way you feel like it, or whatever is available just to have 265 country comparability. I don't think it serves any purpose except to get publicity. You can get published in New York Times, you can get published in Times of India, you can get published everywhere. But the hard work is to do the comparison. If we are worried about education, let us compare. What is the enrollment rate? Somebody asked this question that 40% education of children. That's not true. It's 100% enrollment now. And for the last 3-4, well, Surjit has the data much more. We have to look at these things. When we are looking at 70% illiteracy, that's the old people. And just throwing out that we have 70% illiteracy, either we say, okay, we have to educate now everybody who's above 60, fine, then it's operational. But using that to show that education in India is terrible serves no purpose in my view. One should then focus on the quality. As Surjit has mentioned, we have 100% enrollment. We have 90 to 100% now among the young, but the quality is poor. So then you have to find a quality index for comparison. You don't have any. And you'll keep talking about these human resource indices, just so 265 countries are covered. So as I said, that's my personal view. I find these indices are very arbitrary in the sense that they are really for publicity and they do not serve the hard purpose, which is to improve the functioning of the social sectors, to functioning of the Indian society and so on. I don't find them very useful except for nice articles in the newspapers. Sorry to go into that, but with that I conclude this session and hand it over to Charan. Thank you for all the participants and our speakers. Thank you.
I must say this was a very good learning experience for me. I'm sure for many people in the audience. We have had a huge audience today, and I must thank all the three. Dr. Virmani, you yourself is an author and you agreed to chair the session. Dr. Bhalla and Karan for having agreed to present the paper on our under the aegis of EGROW, and of course Professor Kundu, who readily agreed to be the discussant and discuss these issues. I'm really thankful to all of you. It was really a pleasure listening to you and a great learning experience. Continuing with our journey of the EGROW Foundation on policy-oriented research, Next week, we have Arvind Panagaria from Columbia University speaking to us on economic reforms. And the month of July is dedicated to India 2047. So we are starting with insurance on July 1, and the whole of July, 5 Fridays that we will have, we are dedicating it to India 2047. That is our Prime Minister's thought and dream. India at 100, what would it look like? We'll be looking at various facets of India, and Dr. Arvind Virmani's paper, India 2050, will be the base of the discussion, and we'll be sending you every week flyers. So I would request each one of you, those 5 Fridays that we have in July are going to be really visionary and giving us a view of the best minds in our country, experts, professionals of where India is heading or what their perspective of India in 2047 is. So I would once again thank each one of you. Today's presentation will be available on the web tomorrow. I'll share the link on the Twitter as well with each one of you. I'm sure it's going to be a great learning experience for you, other policymakers, and your students. Once again, thank you, all of you.